Hey everybody, my name's Keith, the Unbroken Pelvis YouTube channel and the official Unbroken Pelvis Discord server. Welcome to our live AMA on pelvic floor dysfunction recovery. Today I'm joined by licensed pelvic floor physical therapist Becca Ironside, who will be helping us answer your questions. Before we dive in, I just want to clarify that while I do have extensive experience and personal knowledge in pelvic floor dysfunction recovery, I am not a licensed medical professional. So information shared here today is for educational purposes only and should not be taken as medical advice. Always seek a qualified healthcare provider for any questions or concerns and before starting any new treatment or exercise program. With that said, today we're going to go ahead and kick it off. We're going to start by reading some of the AMA questions that have been posted in our Discord server over the last week. And then we're going to open it up to anyone who is live on the call. But for now, I'm going to go ahead and start off by reading some of the questions. Becca, are you good to go?
Yes.
All right. Okay, so our first question comes from ZZMK, and I'll just go ahead and summarize this. They have a history of coccydynia, which is tailbone dysfunction. Basically, it's tilted towards the right, and so he was doing some PT, and they were told that they have a tight left and weak glute. So the first question is, am I able to do sandwich drills with good core activation? Or they say they are. And then 2, glute bracing and left glute activities. They're able to do properly if I push hard against the glute. There's something here about being able to relax the anus, which I do cover at length in my last video on how to reverse Kegel properly. So the question here is, so what else can be done to engage both glutes, keeping the anus relaxed? Again, that's in the video, and already doing strengthening with monster walks, glute bridges, clamshells, hip abductors. Those are all great moves. And so basically, the best answer I can give for this is it is important to know if you have a left weak glute or a right weak glute. It's important to know if they are weak, then they are also probably not activating properly. And so I would definitely spend time doing certain moves that you're focusing more of the effort on the weaker muscle so that you can both increase activation. And then as you increase activation, as you continue to do movements, you will develop strengthening. Beck, any thoughts on that?
For this individual, they're probably doing bridges. Bridges are, when you bend your knees and you lift your butt off the ground. So in a case like this, if one glute is not firing as well as the other, you're going to bend that knee. So you're going to do what's called a unilateral bridge. So the weaker glute, you're going to bend the knee and you're going to lift the pelvis, and the other leg is going to stay straight underneath you. So you're biasing the weaker side.
Excellent. Questions for some of your symptoms that you experienced. You stated that you had numbness and sensitivity loss. Was this worse on any specific area or generalized throughout the region? Was it worse in the glands? Wondering if you could go into more detail. 2, was your pain more dull or aching? Or was it neurogenic, nerve or shooting pain? So I will cover these 2 questions here in one answer. I had a lot of pain. I had mostly rectal fullness, rectal pain, this undescribable tickling sensation that was almost like absolute fear, like when something bad's about to happen, and it would not go away. It was 7 out of 10 most of the time. I also had just a general penile ache from the bottom to the top. I had bladder pain. I had ureter pain. I also had penile numbness, about 50% loss of sensation. And then there was more than 50% loss of pleasure. It was almost like there was no pleasure, and especially orgasmic pleasure was gone. When I would finally reach climax, there was almost nothing there, only maybe 20%. And it was accompanied with very sharp, very terrible, immediate ureter tip pain that would last for hours. How long did it take for the sensitivity to come back? Was it gradual or over a long period of time? Indicating that the nerves were regenerating or healing, or was it quick once the pelvic floor improved and blood flow was restored? I would say it was definitely gradual, but I don't remember exactly how long it took for that to go away. Again, my primary issue was the rectal pain. I almost just kind of wrote off the penile pain because it was like a 3 or 4 out of 10, where the rectal was between 4 and 7 most of the time. I was surprised at one point. I was like, it doesn't hurt anymore. And I can feel things more. And my erections are now fuller. And so it was a very slow process, but it was realized kind of towards the middle of my recovery road. And how long did it take? I'd say I had 50% reduction in symptoms after like 6 to 8 weeks of doing functional movement treatment as in conjunction with the stuff that I was already doing. And I was great with 50%. I told myself and my wife, I was like, I could live like this the rest of my life because I was in such a bad place at 100% pain. But the rest of the journey is a little bit more complicated for me because it took about 8 or 9 more months until I got to like the 90% threshold of recovery. And that was interrupted by a pretty bad spinal injury from doing a ego lift in my garage gym. So, but you know, I would say that if you're doing what you're supposed to be doing, within several months, you should be able to reduce your symptoms. Did you have any scrotum retraction and cold testicle symptoms? I had a little scrotum retraction, but not so much cold testicle. I did have a cold glands. That was one of the trademark things that I noticed.
Real quick, I just want to say that was a beautiful explanation. And Keith is talking about symptoms of a condition called hard flaccid. So if you have never heard of hard flaccid, this is something we talk about all the time on this server. So you can join us, but it's a condition characterized by changes of temperature and sensation and changes of shape of the penis during arousal. So at the end of this Q&A, we're going to throw in a little story about the impact of pain and the fear that it causes and how those two are very, very intertwined. So part of what Keith is talking about is not only did he physically recover, but he was able to face that fear. It's a tremendous amount of anxiety when something's going wrong with your genitalia, and he was able to
For
heal
sure.
from it. So,
Okay, question more on anatomy. Can nerve stretch injuries cause PFD? It'd be nice to know if the relationship between dorsal penile nerve and the pelvis. Also, from a PT perspective, can the dorsal nerve be compressed? That is the terminal pudendal branch. And if so, how does one deal with that?
okay, so with a lot of, well, let me start first with the nerve injury. So a nerve injury would be something that would severely take a nerve and take it to its end range. So the leg going in a very strange direction during a skiing injury or something of that nature. Those are unusual injuries. So a nerve traction injury is something the average person is never going to experience in their lifetime. Secondly, most people have some pain within their legs, and when they do, we got to look at where the nerve begins, which is it exits out of the spine, but then it travels through osteofibrous tunnels. So we have to know where those tunnels are, and at any point along the pathway of the nerve, it can get compressed there. So the key with healing nerve pain and tension is basically something called nerve flossing, where you very gently take the nerve and you stretch it through the tunnels through which it must travel, and then you also rest the area and you strengthen around the area to provide stability to the entire body. In terms of the question about the dorsal nerve root of the penis, it is a branch of the pudendal nerve. However, what we find is a lot of people get hung up on healing a specific nerve or a very specific pelvic floor muscle. These are tiny nerves and muscles. And so what we need to look at is we need to look at the broader aspect of pelvic health, which is one muscle is never going to be the driver. It's going to be a cumulative effect of inflammation in various structures, nerves, muscles, blood vessels. All of this is communicating with each other. And if you look at the pelvis, it's a closed space. So look at that. All of these nerves, arteries, everything runs through here. This is a female, sorry about that. But the point I'm making is thus you can't specifically implicate one structure when you have pelvic discomfort. It's not possible. Everything's communicating with everything else. So try not to drive yourself crazy by pinning down what muscle, what nerve is the problem. It doesn't matter. We're healing the system. That's it.
Yep. No, I talk to a lot of guys and they're like, this one muscle is tight. What nerve goes to it? And how do I release this muscle? And how do I free up this nerve? And what can I do about this one thing? And then it'll move, it'll shift as they begin, the treatments there. Then they're like, okay, it's moved here. How do I do this one? It's like, you can't chase these things. Like there's not, even if you found a way to release that one specific area, okay, it released and the nerve feels a little bit better for 10 minutes. And then it goes back to being tight because the hypertonicity is what's causing the compression. And the hypertonicity is a sign of a bigger problem. And that is musculoskeletal imbalances that's contributed to by mind body stuff and subconscious clenching. And so we have to learn how to open everything up. We have to treat the musculoskeletal imbalances and bring balance to the system. So Okay, could one of the nerves leading up to the penis be compressed by hip impingement? I was born with severe femoral anteversion that never went away as my skeleton developed. I got an MRI last year and they found that I have an impingement in the left hip. Are there any nerves or arteries that run through and around the hip? I'm going to let Becca answer this one, but it's my understanding that that there are obviously nerves that run through the muscles and the ligaments and tendons around the hip. However, these nerves, while they may refer pain to other areas, typically with hip issues are known to cause pelvic floor hypertonicity because, like we've talked about before, but the pelvis is a master compensator. And when one thing over here is out of balance, it's going to pull on those structures. The other side is going to try to tighten up and compensate to restore balance to your movement. And then that compensation is the hypertonicity is causing the compression on the nerves that directly affect the genitals.
So this is your pelvis, right? And look, these are the sockets where your hip joint's going to go. So your femur, the ball of it is going to sit right in there. So we've got two hip joints and they're doing what they're doing. And in this case, the individual was born with hips that were twisted inward, right? And so that's going to impact the relationship of how that ball moves within the socket. And there are many, there's a labrum in there. There's a lot of nerves and blood vessels in here. And these muscles that support that femur, they're attaching right where the pelvic floor muscles do. So any hip issue could potentially lead to a pelvic issue simply because of proximity of tissues and muscular attachments. So yes, anybody with a known hip labral tear, this younger population tends to talk about that a lot. A known labral tear is going to cause some form of pelvic floor problems. And it's a question of balancing out the system and going to the right professional to say, okay, here's what we have to do. Maybe we have to mobilize and stretch one hip. Maybe we have to strengthen the other. But the point is that we need to make a pelvic girdle that can sustain and withstand the impact of living in the world, taking steps, walking, standing, squatting, and can do it in a balanced fashion. And when things are out of whack, it's very easy to get fearful and to start to notice, oh my gosh, now I've got urinary pain on top of hip problems. What's going to happen?
Yeah.
What's going to happen is you need to stabilize the system.
Yep. Yeah, and a lot of people, think that a strong pelvic floor is achieved by doing Kegels. And, that generally for men with pelvic floor dysfunction, that is the last thing you want to do is to start Kegeling. What you want to do is you want to look at the systems that are below and above and on the sides of it. And once those get stabilized, then the pelvic floor can learn to relax and resume. A hypertonic pelvic floor is really a strong pelvic floor, but the wrong kind of strength. Okay, obstipation. I'm assuming this means constipation that is managed by laxative along with pudendal neuralgia. Does this hint to pudendal nerve entrapment? And can a person with this situation get better with conservative treatments? I'm going to go ahead and answer this last one and say absolutely. I did. Many others in our Discord server have either fully recovered or experienced a majority recovery just in the constipation issue by doing some of the protocols that we mentioned. But Becca, I know that we're going to be doing a video soon on pooping, so go ahead and chime in on this one.
So a lot of people, they ask questions like, I have levator ani syndrome, or I've got, rectal spasms, I've got all this pain, and I'm severely constipated. What's the best way to release these muscles? Well, the best way to release these muscles would be to have regular bowel movements, because the more you've got up in your rectum, the more stress you're imparting on everything around it, right? And so the nerves, the blood vessels, everything is sort of congested if there's way too much stool there. So what we try to tell someone like this is reliance on, laxatives. It can happen. Some people really do need them from time to time, but that's not the way to treat pelvic pain and rectal issues. The way to treat it would be to get yourself on a bowel program where you're capitalizing on the times when your body's ready to have a bowel movement. So for a lot of people, that's after a meal. And to have bowel movements, you need a lot of calming parasympathetic nervous system input in order for the bowel to open and empty. So the more stressed you are, you're at work, there's stalls, you're not going to have a good poop there. There's no way. So what we suggest for the chronically constipated is when you have one meal of the day, make sure you are home and then you go sit on the toilet. Don't sit there too long, but sit there, try to relax, try to breathe. And then you're capitalizing on something called the gastrocolic reflex, which is You start eating food, the poop comes out. Animals display this beautifully. And Keith actually knows this firsthand because his body is sort of hyperactive in terms of the gastrocolic reflex.
Yeah, so I've always dealt with irritable bowel syndrome. I think it comes along with the territory of being on the hypermobility spectrum, known as HEDS or hypermobile Ehlers-Danlos. Sometimes, especially if I'm not eating well, I can have 7, 8, 9, 10 bowel movements a day, usually 2 after each meal. Especially if I'm eating a lot and gaining weight, it's a terrible place to be. But what I learned during pelvic floor dysfunction is that it was just too much. It was every time I would eat, I would have 2 or 3 bowel movements, and not all of it would come out. And I would always have that rectal fullness. There would be a lot of remnant just stuck in there and wouldn't come out, and that would cause pain and more hypertonicity. And so I just kept thinking to myself, I've got to change this. I've got to change my bowel habits because it's making things even worse. And so what I decided, I had tried intermittent fasting before as a weight loss protocol, and I wasn't intermittent fasting at the time. And I was like, you know what? I remember when I was intermittent fasting, I would eat between like 3 p.m. and 7 p.m., like a 4-hour eating window. And I wouldn't have bowel movements until the next morning, usually with a couple cups of coffee. And then I'd have, 2 or 3 bowel movements back to back in like a half-hour period. And then I would be, I'd be cleaned out the rest of the day. And so I went back into that type of a schedule where I was eating at one time and pooping in the morning. And it actually kept my rectal tract nice and free during the day. I didn't have that fullness and pressure, and that helped bring the pain level down. And once my pain level was down, everything started to open up a little bit more. And I found that, passing bowels was a whole lot easier, and I wouldn't be sitting there as long. And so I think that's great advice on getting on some sort of schedule. If you can do intermittent fasting, I know it's not everybody's favorite. We all like to eat breakfast, but maybe you could delay breakfast a little bit, and that'll kind of keep your pooping window. It'll move it, it'll shift it slightly. And so that's great advice, Becca.
I want to show you this little rectum. It's very cute. So inside your rectum, right? This one doesn't fully come apart. But anyway, inside of it, there's little sensors. And the sensors detect, am I full? Am I empty? What's the quality of this poop? Is it sloppy, messy? Is it mushy? Because some rectums don't know what to do with that. So they'll force it out in Keith's case. Or if it's mushy, this is the very constipated person who's like taking stool softeners all the time. And they're like, why is nothing happening? It's because their stool is a consistency wherein the rectum doesn't recognize what to do with it. So it's going to do one of two things. It's going to hold on for dear life, or it's going to empty, empty, empty. And for people who are constipated, they're looking at Keith like, oh, I'm jealous of you because, you know, you're never holding anything back. But Keith's life is pretty difficult in that regard too. You kind of don't want either thing. So
No.
the goal is to have your body create stool that your rectum can recognize and train the rectum to empty at certain times of the day during certain calm circumstances. And that will create more of a regular pattern for you for the rest of your life.
Yes, and I would just say that diet is also an important key. Eating and hydrating properly. I find that a lot of people like to use bulking agents, and so I don't have a problem with them personally for anyone, but for me, I found that they make me a little bit gassy, like psyllium husk. I don't know if I'm pronouncing that correctly,
You are.
and they didn't really make an impact. But what did make an impact is foods like good prebiotics, like oranges and apples and prunes and bananas, and fruit tends to do better in my digestive system versus like foods like broccoli, which can make me a little bit gassy and stuff like that. And so I tend to do better with fruits versus vegetables. But get to know your body, get to know how your body responds to eating certain foods. Stay away as much as you can from ultra processed foods. Fast food that's going to be terrible on your digestive tract. It can cause irritable bowels. It can cause constipation. So eat healthy, treat your body well, treat your pelvis well, and your rectum well. Okay, let's see. If I breathe in and push/strain for the reverse Kegel, well, that's a problem right there. If I breathe in and push or strain for the reverse Kegel, I recommend everyone watch my video on a proper reverse Kegel. It does not involve straining. It involves dropping or relaxing the rectum, as well as deep belly diaphragmatic breathing to expand the muscles in the pelvic bowl. This seems to make my symptoms worse, clearly so. and pelvic floor muscles become more tense right after, compared to just letting my pelvic floor normally drop and keeping it right there. Why do you think that may be the case? I think you answered your own question, my friend. It is not advised to strain. Straining puts a tremendous amount of intra-abdominal pressure lower in the pelvis onto the rectum. It could worsen bowel symptoms. It could cause hemorrhoids. Heck, if you're straining too hard, it could cause other problems as well, and definitely increase your symptoms. So, any thoughts on that, Becca?
Yes, and for those of you who are watching who don't know what a reverse Kegel is and you're new to all this is a female pelvis. Okay, sorry, I don't have the male one. But a Kegel would be you're pulling your muscles up and in, right? And the reverse Kegel, as he's talking about, is when you sort of do this. It should be a very gentle movement, and it really helps with people who are constipated, people who can't empty pee. This is a lovely way to sit on the toilet bowl and sort of release everything in your system. But you should never be, this person's talking about opening and forcefully holding. And that's not going to really help you. That would be like taking a muscle to end range and contracting it there. So we don't want either. We just want gentle opening. I've made a video years ago and it talked about being in a beach house and there's drapes going out to sea. And so the windows are open and the drapes are going out to sea. Men might not like this analogy as much, but it can help you visualize a little bit better.
Yes. I have moderate to severe urinary retention that fluctuates. Sometimes I'll have a full bladder and I won't be able to urinate. And best I'd be able to do is it would just continue to dribble out every few seconds while I'm trying to urinate. Any advice you have for this, and how did you deal with this and overcome this during your recovery? Man, I absolutely hated this part of my PFD. My pelvic floor physical therapist had convinced me to start a pee diary. And I was absolutely blown away by how many times I was peeing in a day, like 30 times I calculated one day. And that didn't even include the nighttime. It was pretty much every 10 to 20 minutes. And it would be difficult to start a urine stream. If I did start it and it actually continued, which it usually did, and it was just dribble after dribble after dribble. And it would sometimes take me 20 or 30 minutes just to empty my bladder. And I had just emptied it 10 minutes earlier. So I was literally on the toilet half the day. And then, I would empty out most of it, but there would still be some that I couldn't release. And if I did get a stream going, it was, it wasn't a full stream. I think I read a study once where they determine a urinary flow by looking at the number of twists that are in the urine coming out of the penis. And so 3 full twists of the urine stream indicates a good flow. 2 is a moderately impacted flow, and then 1 is a very poor flow. And I was between 1 and 2 during the entire course of my pelvic floor dysfunction when I was able to actually generate a stream. But it was and a lot of times it would just spray.
I love what you said that. So what are the turns in the pee stream? What is that?
So, when you look at, and obviously you're not a guy, so, but maybe you could chat with your husband to demonstrate. But, you should see it as it comes out of the tip of the penis. You'll see the stream like a spiral. Like if you had a flat coffee stirrer and you were able to spin it, you'd see the spirals in it. And so you can see the stream because it comes out of the urethra flat. And then it twists, and then it becomes a little bit more, cylindrical in shape. But as it comes out flat, you can actually see the spiral of it twisting. And so that's an indication of flow and flow strength.
So like good velocity of flow.
Good velocity of flow. In other words,
you've got a garden hose with no kinks in it and no obstructions and no rust inside. So everything's flowing freely. I never knew. That's very cool.
Yeah, I found it interesting, but I knew that something was wrong because my urine stream did not look like it normally had. And so, getting back to the question here, what did I do about it? I wish there was a magical switch I could have flipped to make my urine stream come out better. I didn't find that magical switch until I started addressing the underlying issues. Just like most of the questions we have here, the urine symptoms are a direct result of pelvic floor hypertonicity. And so we have to incorporate all of the principles of recovery, which involves mind, body, it involves neuromuscular, it involves musculoskeletal, diet and exercise, sexual health. There's all the different components that go into managing pelvic floor dysfunction. We have a channel on our Discord server called Tenants of Recovery, and it goes in detail with these 5 tenants. And those are the tenants that I use to recover, and the same tenants that others in our server have also successfully recovered from. And so we have to reduce the amount of hypertonicity that's in the pelvic floor in order to see changes in the urinary tract and quality of flow. But one thing that I do recommend, as we mentioned earlier, is reverse Kegels. Reverse Kegels before you urinate can kind of help lessen that hypertonicity temporarily.
Yes. And just real quick, I want to add, this is my bladder. There's little sensors, right? And these sensors tell the brain, am I full? Am I empty? The problem once you develop a urinary issue like Keith and I have both experienced is these sensors get completely confused. So they're going to send a message to the brain every 10 minutes of, I've got to pee. It's really false information, but the bladder's so angry at this point, it's screaming messages to the brain. So one of the best ways to retrain the sensors would be hydration and sort of deferring the urge to pee. So every time you get that twinge in your penis, hold back. The average urinary voiding time, so how often you should pee, is technically between 2 to 3 hours. So if you're peeing every 30 minutes, you're tricking your bladder, you're overactivating your pelvic floor, it's in spasm, and your whole body's very confused as to when should I pee, when should I not. So for this person's question, when you're in that horrible flare, try to defer the urge as long as you can and always sit down to pee. This is a biggie. Women tend to hover in public places. They squat. You're never going to empty that way. And standing, for a man, you're less likely to empty. So sitting down can really help you empty further.
Yeah, and I'll just piggyback off that too. Well before my pelvic floor dysfunction, I was always one who kind of struggled sometimes with urinating in public. I think they call that bladder
Mhm.
shy, pee shy, bashful kidneys. I've heard a few different iterations of that term, and I think that folks who have that growing up or even currently tend to be more likely to be in a place where they get pelvic floor dysfunction, because I think that there's a lack of proper coordination between the brain and the muscles down there to release the pee. And so I think sitting was definitely always helpful whenever I was dealing with, there's no way if I'm in a crowded bathroom, like at a ball game or something like that, and there's like one urinal open and there's a line of guys and it's my turn to get there. And I go to that urinal, I'd stand there for sometimes 5 minutes, like, come on already, just go. And like no stalls are open. So that was a nightmare for me growing up, and probably still is. But I have gotten better with it after learning, how to recover from pelvic floor dysfunction. I found that I have a little bit better control to release the urine in a standing position in an environment where I would normally be pee shy. So I just found that fascinating. Here is a question from Vox. Are there any typical or common sports related exercises or stretches that you would advise patients with pelvic problems not to engage in until their pelvic stuff is under control? I would say any dynamic sports where there's abrupt dynamic movements, where you're jumping, you're lunging, you're squatting and changing positions quickly, changing positions laterally or vertically, horizontally, and anything like pertaining to running, any sort of high impact routine, I would try to avoid. If you're able to kind of slowly get into it and you find it doesn't flare you, that's fantastic. But I was pretty much immobilized. I do want to say that it's important to not go the opposite direction and become completely fearful of movement. Like walking is important. Exercising your core and your glutes are important and needed for pelvic floor dysfunction recovery for most. But so you don't want to become fearful and stop moving. You just want to avoid, large abrupt movements where you're changing velocity and ending velocities very quickly.
Awesome. And I want to just add something about running. I know a lot of avid runners and one, but I know about running that a lot of people are very fond of it. I just want to show you something very interesting about running that I learned from my good friend Bryn. And it's that here's your pelvis, right? We talked about the hip joint here, the hip joint here. So running is a single leg stance activity. There's never a time when you're running when both of your feet are on the ground at the same time. So if you do not have the strength to be running, what's going to happen? Your pelvic floor is going to shift this side, this side, this side, this side with each and every heel strike. What are you doing to your pelvic floor? It constantly has to accommodate to these forces. And for many people who don't have the lower body strength, it can't do it. So it's going to put these people in flare and potentially keep them in a flare. And it's not to say you can't run, but you really need to go to a specialist and know that you are strong enough to run if you want to avoid pelvic floor dysfunction.
Excellent. Question about gaming from I'm Just a Lizard. Can we still play video games? I notice that when I play competitive games, I tense up a lot. Can we at least play more chill games like Minecraft or something? And how to stop tensing while playing? I love this question. I was a Call of Duty mobile junkie before pelvic floor dysfunction. And if I'm being honest, I think I made my pelvic floor dysfunction either more likely to kick in, or like I think it definitely would make my symptoms worse. And I just absolutely love playing Call of Duty. I actually had to slow down how much I was playing, and during some seasons I gave up playing it, because I would notice anytime I would play, whether I was sitting or I was standing, it just that you're in overactive sympathetic nervous system state, because you're trying to kill, you're trying to run, you're trying to dodge, you're trying to, and then you get surprised when someone, sneaks up behind you or runs into the room really quick and they've got the gun pointed at you, and you're like, oh, and you freak out and you tense up. And so that was something that I had to put to the side. I think other games are great. I didn't have any other game interests, so I didn't find a replacement for it. I just started reading and watching videos a little bit more. But it is important to not play games that are highly competitive like that. And how to stop tensing while playing. Don't play until you get a better handle on it. Becca?
I First of all, I just love the correlation between gaming and pelvic floor hypertonicity. And all these years, until I met Keith, I really never made the connection. So I love that. In terms of gaming, again, we talked about what is a normal urinary voiding pattern. It's between 2 and 3 hours. So we would suggest, if you're playing a game, whether it's intense or whether it's not. I don't know anything about Minecraft. I just know my nephews used to play it a lot. But anyway, you should take to 3 hours, so maybe 2.5 hours. Set something on your cell phone to alert you, and then go sit on the toilet for 10 minutes and do the reverse Kegels. If nothing comes out, fine, no problem. Don't force it out. But it's a great way to sort of relax your pelvic floor and get yourself back into the vibe of sort of calming the nervous system down to empty bowel, bladder, whatever needs to be done. And then it's a reset. So then you can go back to your game and kill as many people as you need to and call it.
Another thing too is that when gaming typically wasn't very especially on mobile, it wasn't very easy to stand and play. I preferred to be sitting, and so sitting was painful for me, and sitting would also cause additional hypertonicity. It caused my muscles just to go in a total spasm. And so that's something else to consider. If you're gaming for 3, 4, 6, 8, 10, 12 hours a day, that's a lot of sitting down. That's a lot of pressure that's on your pelvic structure, and that can obviously contribute to symptoms. So if you do like to game for multiple hours a day, I'm not judging. I've been there, but make sure that you are taking breaks, like Becca said.
I'm gonna go ahead actually and chime in here real quick, if y'all don't mind.
No, come on.
As an avid gamer who's not going to stop with pelvic floor dysfunction. So one of the questions the guy asked was, how do I stop doing this? And the answer is correct. You don't. It's a natural human reaction for the pelvic to tense up when you're in a tense situation. You're watching a scary movie, you're driving around, you get in a close call, you're on a roller coaster, everybody's pelvic is going to tense, right? And the same can be said for gaming. Keith said, if you're playing a competitive game like Call of Duty, and you're playing Search and Destroy, it's a 1v1, your pelvic is going, your pelvic floor is going to tense up. That's fine. What I made a point to do is I changed my gaming habits a little bit. So I game for less in one sitting, for one, like Becca said, take breaks. I make a point to stand, not the entire time that I'm playing, but I alternate between standing and sitting to give my pelvic floor a bit of a rest. And every time I do notice that I clench up, I immediately do a reverse Kegel.
Very good.
To counteract that.
I love
It's
that.
just something you have to start becoming conscious of, right? I don't know if
Yes.
there's any one trick to do that. Some people like doing something called habit stacking, where every time they perform a bad habit, they put a good one on top of it, hence the reverse Kegel. But it's really just a matter of changing your habits and your relationship with gaming if you want to keep doing it.
I love that, Jack. That's great advice. Habit stacking. I'm going to look that up. I need to stack some habits in my life right now. All right, moving on to the next question. We're almost done here. Go. Following bowel movements. This is when flare-ups are the worst and seem to be setting back recovery, even when I try not to strain. Any advice on what to do before and after? Reverse Kegeling is a great thing for me to do before bowel movements, and after. Also, just a quick reverse Kegel, just to kind of let the pelvic muscles know that it's okay to open up. You don't have to have that rebound pain and tightening afterwards. But Becca, any thoughts on that?
I treated a patient years ago, and she was raised on a farm, and there was an outhouse, and there was a snake that lives near the outhouse. So
Mm.
she was severely phobic of snakes, and so she developed sort of chronic constipation throughout her life and had very similar symptoms to what this person's talking about. So in terms of, if you know that bowel movement is going to be painful, your brain is very smart. So it's going to say, I'm not going to do that. I don't want to
Nope.
feel pain today. So I'm going to hold back and I'm going to hold back. And then this becomes a pattern. So this person, they haven't pooped in a week now. And they're in this horribly fearful state of anticipatory pain. And so, what I suggest for people like this is try to wake up earlier, because the first thing in the morning is actually the best time to poop. It's your bowel is primed for pooping. It helps to wake up earlier so that you can get ready for your day in a safe environment, which is your home. And you know that if the urge comes, you're home. So that's wonderful. So reverse kegling at home. Something else that can help is chewing something when you wake up. So what that'll do is that'll start peristalsis through the whole system. So that's starting these wave-like contractions through the bowel, which we definitely want to capitalize on. So waking up in the morning earlier, being in a safe space, chewing something. A smoothie won't do this. You need like a hard fruit or something where you're chomping, and that is going to stimulate your peristalsis. Then you're going to have the bowel movement in a safe place. And then if you're in pain, fear, etc., get into the fetal position for 10, 15 minutes. Breathe deeply, and you should be able to reset the whole sympathetic fear, pain response, move on with your day. After you've done this for a period of time, you've trained your brain of bowel movements aren't scary anymore. That's what you need to be doing.
Very good.
My favorite was prunes. I would take 2 prunes after I would eat, as those are really good. I would also take hot teas. Peppermint teas were pretty good for what I would have to deal with. And also, this isn't necessary, but I would take dietary inulin. You could take a spoon of that, put it in water. Sometimes it'll help. I use it a lot, and it helps my bowel movements a lot. Made it a lot smoother to go through and out. And then if I had a bad one afterwards, Dr. Teal's magnesium salts, Keith, you know these. And then also I would do dilation. Both of those would be helpful after a bowel movement that was a little bit nasty, if it did happen.
Real quick, for those of you who don't know dilation, they're plastic wands that look like candles, tapered candles. And people, and I know this sounds very foreign to anyone who is listening to this for the first time, but they're very useful to be inserted for women vaginally and rectally, and for men rectally, to release the pelvic tension. I know it sounds very, very bizarre, but they're tremendously helpful for so many people.
Okay, I love this next question here. When do you know it's time to move on from your pelvic floor physical therapist and seek out another one? Although my pelvic floor PT is great and she really helped me in moving my pain from an 8 to a 1 to 3, I feel like my recovery has plateaued. Is it advisable to switch mid-recovery? This is something that I sometimes have a hard time talking about in front of Becca, because I absolutely love my pelvic floor PT, and I think Becca's the cat's meow. But I do notice that there tends to be a big difference between specialists, like, and it's just kind of the state of our medical system, not even just the US, but internationally, is that there's so much specific specialty. You know, so someone has pelvic floor dysfunction, or they have pelvic floor symptoms, and so they go to their doctor, and the doctor, you know, runs some tests. You get an X-ray that's negative, there's no growths. You get an ultrasound, you know, and that's fine. It's like, well, I'm going to refer you to a urologist. So you go to the urologist performs additional testing. He tests your urine and your blood, and, you know, he may recommend a procedure where they go into the penis and make sure that there's no strictures, and that's traumatic in and of itself. And then the urologist throws up his hands and says it's all in your head. And so you probably need pelvic floor physical therapy. So they refer you to a pelvic floor physical therapist. And a pelvic floor physical therapist is going to, you know, have a lot of knowledge in working mostly with women. Some of them work with men. Not all of them work with men. There's a lot that won't work with men. And so you find a pelvic floor PT that works with men, and the first course of action is usually internal work and diaphragmatic breathing, which is great. But if your pelvic floor dysfunction is caused by a musculoskeletal imbalance, the pelvic floor PT is going to be somewhat limited, unless they're very, very special, like Becca or some of the other ones that some of our folks have gone to, where they're not going to look at the hips. They're not going to look at the lower back. They're not going to look at the legs or the adductors, unless the patient has specific issues that they're complaining about in addition to. And so if they don't have anything outside of the pelvis that they can say, well, you know, the inside of my thigh is always tight, or my psoas, the hip flexors, they're always hurting. Like, they may not know to do a functional movement assessment. And so I would say that if you're going to a pelvic floor physical therapist, and, you know, you've experienced some results, that's great. Continue to go to them. If you find yourself plateauing, think outside the box. For me, pelvic floor PT was not the final solution. It was one of the solutions. Internal work did help me. Diaphragmatic breathing did help me. Reverse Kegling did help me. But I had some severely over-tight psoas, hip flexors, because I sat for so many years. I was always in a state of flexion. Get the camera right. I was always in a seated position, and so everything was shortened and tight between my legs and my abdomen, and so that made my pelvic floor hypertonic, and so I had to address things outside the pelvic floor. Then I learned that my glutes were weak and that they weren't properly activating, and that was contributing to my psoas shortness and tightness. And then I learned that my core wasn't properly activating. I didn't even know how to brace my core properly. And so there were so many different moving parts above and below my pelvic floor that, you know, my pelvic floor PT wasn't necessarily aware of, and there was no discussion of that or testing on that. And so I really found great results going to someone who is a functional movement expert, someone who understands functional movement patterns and fascial lines, and they were able to help me kind of unlock some of the things that were restricted and restore balance to the system to help me. So if you have a pelvic floor PT that understands functional movement, that's fantastic. Don't let them run away from you. If you feel like you've kind of plateaued, maybe try seeking an additional type of physical therapist who can help you see things from a different perspective.
Awesome. I love it. And I think you're right. I think, and I'm just going to speak for my profession here. As a pelvic floor physical therapist, you're really limited in time with people. And so even if you do have the skill set to sort of help with that next step that Keith is talking about, you might simply never get there because you're spending so much time talking to somebody, touching them in these very intimate places. And this brings me to my next point is of you really need to like the person who's touching you in this area. So as a guy, I know guys go to barbers and I know they might like their barber, but the guys are not having they don't need as much of a connection with their barber as a woman. So a woman, if someone's touching our heads, this is our computer. This is very important to us. And a lot of women, they won't go to a masseuse or a hairdresser if they don't like them personally. If they don't have some sort of common energy feel with this person. And so I actually needed spine surgery. I needed a lumbar fusion. And I went through a few different doctors, but I found the surgeon that I liked the most as a human being. Now, he'd gone to Harvard and Yale, so there's that. But I really needed to like this person because they were putting, metal objects in this very intimate part of my body. And so if you are going to a pelvic floor physical therapist and you've hit a wall, either it's an energetic wall with them, they're not hearing you, they're not understanding you, or you simply are just plateauing and the skill set that this person has is not going to further you, it's perfectly fine to move on. And honestly, we don't really take that personally as practitioners. I've actually turfed patients to other people. Like my friend, she's really good at functional movement. When I'm done with the emotional aspect, I'll say, you don't need me. And I'm not the most skilled person that's going to bring you to the next level. That next person is going to be somebody else. So just check in with yourself. Do you like the person? What's their skill set? Are you getting better? How do you feel when you go and you leave about yourself and your condition?
Fantastic advice, Becca. Okay, next question. Can a chronically tight pelvic floor cause urine retention that would lead to a bladder and or prostate infection? That one's out of my scope. Becca, I need you on this one for sure.
So men are not prone to urinary tract infections because they have very long urethras. So a woman who's retaining urine over time is very likely going to get a urinary tract infection. A man, however, is not. And furthermore, people talk about infections of the bladder in men. Again, it's rare, especially in young men. And an infection of the prostate really has very little to do with the urinary stream. But there's a lot of people who believe that there's, prostate symptoms related to prostatic infections. There's very little evidence to support that there's infections within the prostate itself that's driving pain. But however, if you do retain urine chronically, you're going to be wildly uncomfortable because what it's going to do, that urine is getting cloudier and sort of more viscous and more yellow, and it's going to irritate the walls of the bladder, right? And that's going to send the message to the brain repeatedly, go pee, nothing comes out. It's a very uncomfortable situation. But will it lead to your kidney shutting down or an infection? It's highly unlikely for men in this population.
Becca, I have a follow-up question on that. We've had a few guys who have, expressed concern over the color, the clarity, and the consistency of their urine. They've stated in the chat that, my urine's it's a little cloudy now, or it's very foamy. Is this related to pelvic floor dysfunction, or is it something that there might be something else going on with proteins or the immune system?
Often cloudy urine is urine that has been sitting in the bladder for way too long. So the walls are getting irritated, right? And they're sort of sticky, and so that the urine's in contact with that. And so that's when you're going to see very cloudy urine. And it may even smell in the absence of infection. We see this all the time. People think, oh, it smells so strong. It smells strong because it's been in your body for way too long. And it's cloudy because it's picking up on all of the junk that has been holding inside the bladder. Foam is normal. I mean, I know when I've had a great urinary stream. You were talking about this thing with the
spiral, yeah.
Yeah. For me, I know when there's like bubbles. I'm like, oh man, I emptied my bladder. That was high velocity. That's wonderful. So
Yep.
the bubbles are really nothing to worry about.
Yeah. And we see this a lot in the chat. Folks tend to get hyperfixated on one thing, and then the fear cycle kicks in. And so, if your urine's cloudy or if it's foamy, it's okay, so I'm glad that you were able to answer that. If not previously discussed, can you explain the connection between jaw pain and pelvic pain? And so very happy about this particular question. This is something that Dr. Bo talked about when we did our live stream. And, Dr. Bo is a functional movement expert. He understands the connection between the muscle and the fascia and the mind-body neuromuscular connection with the musculoskeletal system. And so the deep front line is basically categorically, it's the fascia that runs literally from head to toe. And you can see here, this is from the book Anatomy Trains, where my wife studied with Dr. Bo. When he was at our clinic, he's like, you need to read this book. You need to take this course as part of your medical massage therapy training. And so she purchased these books, she read them, and it's actually fascinating information that's inside these books. But you can see here, this is the superficial back line, and you can see it literally goes head to toe. And this is fascia. If you've ever worked with a raw chicken breast, sometimes you'll see like this clear coating on the outside that sometimes, has these little like ropey things through it. And, you try to pull on it and it's inherently stuck to the muscle in some areas. It slides off in others. And that is essentially fascia. And so the fascia that we have in our body, it's intertwined with our muscles, and there's a direct connection. And a lot of studies have actually shown that stress can cause myofascial changes at a cellular level. Your fascia can flex just like the muscle. Your brain can control when you move how your fascia responds in conjunction with your muscle, and you can get, areas where there's tightness in the fascia. And so whenever you have pelvic floor dysfunction, your entire deep front line is hypertonic, especially around the pelvis. But this hypertonicity can travel and extend and pull all the way up through, and you can't really see it that well up here, but you can see that the deep front line is directly connected to your face. And so there is a correlation with some folks who experience, TMJ type symptomology where their jaw is tight, or it's, tilted to one side and it clicks and it pops when they have pelvic floor dysfunction. They may have had the TMJD before, they may have never had it before, but Bo has seen this oftentimes in his clinic, and I know Becca has too. So Becca, thoughts on this?
Totally agree. And in terms of, if we look at this just from a pressure system, your whole abdomen chest is one like pressure barrel. And so the top is your glottis and the bottom is your rectum and min. And so oftentimes, if there's too much pressure in the system, it's going to close down. So it can close down at the bottom, rectal spasms. It can close down at the top, tooth grinding, jaw pain. I'm the queen of this. I was looking through an old journal from my 20s and I was like, another night of tooth grinding all night long. So, and I was very stressed. I was in college at the time and working and supporting myself. So, yes, it's all related. Top of the canister of the pressure, bottom, it's going to want to close down and the pressure is going to increase. And then your belly gets irritated and it's just too much pressure.
Okay, last question we have is how to identify trigger points and how to go about getting rid of them. Also, what should the trigger points feel like exactly? Can trying to break the trigger point possibly flare things up? This is a great question. I think that trigger points can be tough to find. What do they feel like? For me, I know that my trigger points tend to be areas of muscle that are extra tight, and they almost have like a hard or like a rope is underneath the skin. And oftentimes when you press on them, they're going to refer pain to multiple parts of the body, depending on where you press and how hard you press. For me, for external trigger points, I find that a broad-based approach is ideal. I've got tons of trigger points, like my piriformis is sometimes get super tight. My adductors will get super tight. And so I will, sit on or straddle over a foam roller to try to gently apply pressure to those. Again, a broad-based approach works better for me as opposed to a pointed approach. There's one guy that I've worked with that, he purchased these. It's like they're almost like brass knuckles where you put your fingers in them, and then it's got this like large mechanical thumb that sticks out, and then you just dig it in, And I don't recommend using that. I think that can cause more harm than good. But as far as internal trigger points, and I'll cover this on my my internal video that I'm working on here in the next month or two. But internal trigger points, you've got your pelvic floor wand. Where it's got the pointy end, and then it's straight, and then it kind of curves. And so I was told you can kind of take the tip of that pelvic floor one while you're intrarectally and pin it. But I found that to be painful and not comfortable, and it didn't help. It made things worse. So I found that using the broad side of that wand against some of the muscle structures were helpful by just gently kind of pinning it to kind of release those trigger points. Thoughts, Becca?
Beautiful. I love what you're doing with the wand. That's awesome. And for those of you who don't know, there are curved S-shaped wands that can get to certain spots in your pelvic floor that your fingers simply could not reach. We talked about dilators, which are more like dildos, and then a wand is going to be curve shaped. So he's using this wand to release internal trigger points. And I'm with Keith on this. People spend way too much time and energy seeking these elusive trigger points in the hopes that it will relax the whole pelvic floor. And that's not really the way, as we discussed earlier, that this works. It's a closed system with a lot of things going on in there. So even though you release one thing, there's no telling what else might be going on. And the goal is basically to calm down the entire system. Real quick, I want to relay one quick story. that I
Oh,
ran
that's
by
right.
Keith this morning. Okay, so this is a story that I learned about in a pain science class about how pain operates, and I think it's very germane to everything we're talking about. So this is the legend of Boot Nail Guy. A builder aged 26 came to the accident in an emergency department, having jumped on a 15-centimeter nail. As the smallest movement of the nail was painful, he was sedated with fentanyl. The nail was then pulled out from below. When his boot was removed, a miraculous cure appeared to have taken place. Despite entering proximal to the steel toe cap, the nail had penetrated between the toes. The foot was entirely uninjured. So this tells us that when we get into the fear response of pain, let's face it, that guy with the nail going through his boot, his pain was real. There's no doubt about it. And yet it had not pierced his foot at all. So it's a lesson to all of us to understand the relationship with chronic pain, acute pain, and the anxiety and the fear that goes along with it. You have to treat the anxiety and fear, and you have to acknowledge that it's there.
So powerful. So powerful. And I know that fear would absolutely make my symptoms worse when I was dealing with pain. And then, you look at your man parts and you see that they're changing, and it's like, it's going to be like this forever. The shape is changed. The color is changed. The sensation is changed. And it feels like it's a death sentence, but it's not, because, I was able to reverse all of my symptoms. Everything went back to normal, 100%. And so, if you're dealing with pain, if you're dealing with, visible changes, like you're like, yeah, but I'm not the guy with the nail that wasn't in the foot. I got some stuff going on. I want you to know that none of this is permanent, that the hourglassing will go away, the color change, the small glands, every issue that you're dealing with can be reversed. It is a neurological and musculoskeletal response to the hypertonicity, and the body is doing what it does best, and that's guarding and protecting itself. And so, unfortunately, it's just doing it a little too well. So just be encouraged. Don't fear permanency. Nerves can and do heal. Right, Becca?
They do. And honestly, you have us. Just everybody out there, keep in mind, you have us. I know nothing about gaming, but Keith and I know a lot about the pelvic floor, and maybe you could educate me about some gaming, and maybe I could start. But the point is, you're completely not alone. You have us. So come to Discord, the Unbroken Pelvis, and find us, and we can chat all day about this stuff.
Excellent. You can find the link for the Unbroken Pelvis channel in my YouTube channel description. And when you click on there, there's just a quick README that you click through. And once you're in there, we have tons of channels and resources, topical channels. I have articles, and I also have links to my other videos and my blog site. So thanks everyone for joining. Thank you guys for coming. Appreciate it. We'll see you guys later.